Hello out there, this is Dr. Tyrone Mincy. We're going to talk today about 5 reasons. That's 5 reasons that you can't sleep. As always with any of these, hi, this is Dr. Tyrone Mincy. We're going to talk to you today about 5 reasons that you can't sleep. Number 1, sleep apnea. Sleep apnea is inability to be able to breathe, or periods of time where one breathes and stops breathing and breathes and stops breathing. And interestingly enough, the onset of this is usually around the age of 40. So something had to change. It's advisable that you get your healthcare team together and find the cause of your sleep apnea. Oftentimes, machines are used that help force air down into the mouth and down into the lungs so that a person can breathe. And sometimes that does help them sleep better, but it doesn't get to the cause. Seek out a professional knowledgeable about natural ways. And if you have to use a machine while you search that out, that's a good idea because it'll help you sleep. And that's when we heal. The number 2 reason why people have problems sleeping, diet. Now, diet can be a lot of different things, and there are many myriad things that can cause a person not to be able to sleep. We don't have time to cover those here. So we're going to look at the idea of actually having too much food consumed, and we're going to look also at the idea of the hour that one consumes the food. These 2 things alone, if addressed, can have a tremendous impact on a person's ability to sleep. We could go into other things like too much sugar and wrong diet, but we'll leave that to your consultative team. But for now, number 2 is the amount of food and the time that you eat it. Number 3, the number 3 reason why people have problems sleeping or can't sleep. Are you ready? Exercise. Now, what about it? There's something about exercise that can have an impact on the quality of sleep. We know in that people who actually exercise regularly, they have a better quality and a better type and a better length of sleep. But there's something else I'm going to say that might be kind of shocking. Sometimes people exercise too much or they exercise at the wrong hour, and that too will cause a sleep imbalance. Exercising too close to bedtime will leave a person too energized for the body to key down and go to sleep. So diet and exercise play a tremendous role because it's the time when the body is trying to wind down. So you don't want to exercise and you don't want to eat at that time. The next reason, number 4, is pain. Pain. It is probably one of the number 1 reasons why people take medication and seek out medical care for pain. After all, most of the body is made of muscles and bones, and they are capable of generating a tremendous amount of pain. Exercise, proper diet, the avoidance of seed oils, all of these things help manage pain, as well as getting adequate sleep. So it's a little bit of a trap. No sleep makes more pain, and that keeps the cycle going. Number 5, and really not the last reason why people have problems sleeping, but number 5, these will give you 5 things that you can work on, is depression. And the reason why people are depressed is encompassed in the first few that we talked about, the first 4 topics that we talked about, but it also has to do with nutritional deficiency and other matters that go beyond this video. For all these matters, you should consult your holistic professional who's on your healthcare team. And that way, you can get a view of how it can be done naturally without drugs or surgery. And you can also get the viewpoint of how it can be done with drugs and surgery. But I assure you, none of those 5 reasons occur because a person has a lack of drugs in their diet or isn't attached to a machine. Those help a person feel better. But the question I have for you when it comes to sleep, do you want to feel better or do you want to handle the problem? You need help finding somebody? Go to that site right there. Send us an email and we'll be happy to help you find a healthcare practitioner knowledgeable in such matters. I'm Dr. Tyrone Mincy. Till next time.